Fibromyalgia has long reputation for being a controversial diagnosis. Some healthcare practitioners feel fibromyalgia is a legitimate condition that warrants treatment and research, while others feel that it's a garbage can diagnosis that healthcare practitioners throw patients into when they're not sure what diagnostic label to use for a patient's condition. Regardless of the personal beliefs of individual healthcare practitioners, there have been two general classifications of fibromyalgia: primary and secondary. Primary fibromyalgia occurs when there is no underlying health condition participating in the patient's overall health status and onset of fibromyalgia. Secondary results from an underlying condition that contributes significantly to the patient's health status, such as irritable bowel syndrome, and over time gives rise to the onset of fibromyalgia. Post-traumatic fibromyalgia belongs to the secondary fibromyalgia classification, when the traumatic related injury results in the patient developing fibromyalgia. A Canadian study reported that 25 to 50% of fibromyalgia patients reported a traumatic event just before the fibromyalgia symptoms begin. This study surveyed different specialty physician groups to determine which issues were most important in causing the onset of widespread chronic pain after a motor vehicle trauma. 5 factors were studied to determine how important each was to the individual healthcare practitioners in arriving at the fibromyalgia diagnosis. In a case study of a 45-year-old female with whiplash injury who developed chronic generalized pain, fatigue, and difficulties in sleeping, as well as diffuse muscle tenderness. The 5 factors include the number of fibromyalgia cases diagnosed weekly by the healthcare practitioner, the patient's tenure, the force of the initial impact, the patient's psychiatric history before the trauma, and the initial injury or severity. Also described as important were the patient's pre-injury health status, fitness level, and psychological health. All healthcare practitioner groups were reluctant to blame the car accident as causing fibromyalgia, but rather place more importance on the patient's attitude, their personality, and level of emotional stress. The least important of the 5 points were numbers 3 and 5. The orthopedic group also included ongoing litigation as a cause, but as a group they were least likely to agree on the fibromyalgia diagnosis. In this 45-year-old case study, rheumatologists were highest at 83%, followed by general practitioners at 71%, and physiatrists at 60%. The most interesting observation was that once the data was analyzed, only the patient's pre-accident psychiatric history remained in the model of predicting agreement or disagreement with the fibromyalgia diagnosis. Post-traumatic fibromyalgia can result from any type of trauma, not just motor vehicle collisions. Other secondary fibromyalgia causes include trauma, systemic conditions such as irritable bowel syndrome, chronic fatigue syndrome, and other internal disorders that in part alter a person's ability to obtain restorative sleep. Hence, an important focus of treatment should be placed on helping the fibromyalgia patient to obtain restful sleep. Chiropractic management strategies have included manipulation, mobilization, soft tissue therapies, physiological therapeutic agents such as electrical stimulation, ultrasound, cold laser therapy, the training of home use traction, the use of nutritional counseling and supplementation, and the training in exercise. Many studies support this multidimensional approach to treating fibromyalgia, as chiropractic attacks the fibromyalgia condition from multiple directions, often yielding highly satisfying results. We are committed to helping you or a loved one that may be suffering with fibromyalgia, and sharing this information may be one of the most significant acts of kindness that you can give them. If you'd like to find out if you could benefit from our fibromyalgia recovery program, please call our office at 814-238-0232. Thank you.